This is Dr. Brandon Erickson. I wanted to talk to you briefly today about anatomic shoulder replacement surgery. Now, when we talk about shoulder replacements, there are two types. One is an anatomic, where we replace the ball and the socket as they sit, and the other is a reverse, where we switch where the ball and the socket are. So for this video, we're going to talk about the anatomic replacement. Now, the reason we do shoulder replacements are oftentimes because you have arthritis in the shoulder, and this may be limiting your motion, causing you pain at night, and just giving you a general ache in the shoulder. What we do at the time of surgery is we make an incision in the arm over here. We go in between two of the big muscles over here, your deltoid and your pectoralis, and we get down to your rotator cuff in the front here, your subscapularis. Now, to gain access to the shoulder joint, we have to release the subscapularis and where it attaches. Once we release this, we can cut out the arthritis and put in our implants, the metal and plastic implants that we have, which helps get rid of the pain. On our way out of the shoulder, we then fix that subscapularis back, and we close up the incision. Now, the main purpose of the first 6 weeks of our rehab process for this is really to protect that subscapularis repair. We have to have that repair heal for the shoulder to do well. So it's very important that we protect the shoulder for the first 6 weeks out from surgery. Now, when you wake up from surgery, you're going to be in a sling, and you're going to have a waterproof bandage on the front of your shoulder here. You can shower with that bandage on. It can get wet. That's okay. You can leave it on until I see you back in the office. If for some reason the bandage starts to peel off or it starts to look funny, you can take it off beforehand, but generally it stays on pretty nicely. Now, the sling that you have on, that's going to stay on for about 4 to 6 weeks. Now, you can come out of the sling to bend and straighten your elbow, type, write, feed yourself. That's okay. I just don't want you lifting the arm away from your body or doing any type of heavy lifting with the arm for the first several weeks out from surgery, again, to protect that subscapularis repair. I see you back in the office at about 2 weeks out from surgery. We get that bandage off, and there's no stitches that'll have to come out because we use absorbable stitches under the skin and some skin glue, so it's an easy recovery for that perspective. When I see you back in the office, we talk about starting physical therapy. And usually I have you start therapy around the 3-week mark out from the surgery, and they work on some specific range of motion parameters with your shoulder, making sure that they protect that subscapularis repair. I have you wear the sling for about 4 to 6 weeks, and we get rid of the sling. Now, afterwards, you're going to go home with some pain medicine after surgery. You do have a nerve block that helps numb up your arm for the first 8 to 10 hours out from surgery. And when that wears off, you have an anti-inflammatory, Tylenol, and then also some narcotic pain medicine. I want you to take the anti-inflammatory medicine and the Tylenol pretty much scheduled for the first couple of days, and you only take the narcotic pain medicine if you need it. If you don't need it, don't take it. The other thing that can help with the pain is sitting actually propped up a little bit, either in a recliner or with some pillows behind you, and also using a big bag of ice or an ice machine on the shoulder. That can be very beneficial. Now, we do this surgery both as an inpatient and as an outpatient. Most of the patients who have this surgery actually go home the same day. Some patients will stay overnight for one night if they have some medical problems or if there are some other issues going on, but the majority of patients who have the surgery actually go home the same day. Now, there's a few things that we do before surgery that are important to note with this particular surgery. Before you have the surgery, I actually have you get both a CT scan and an MRI on your shoulder. The MRI is to tell me about the status of your rotator cuff, because I mentioned you have to have a functioning rotator cuff to do an anatomic shoulder replacement. So we get the MRI to verify the status of your rotator cuff. I also have you get a CT scan. Now, the CT scan is very important because it gives me a lot of information about your bony anatomy. And actually what I do is I upload your CT scan into this virtual planning software here, and you can see that it allows me to put your implants in the proper place. So actually, I plan your surgery ahead of time for the shoulder replacement so that we can make sure we size the implants properly and we put them in the exact right spot every time. So getting the CT scan is very important beforehand, at least a week or so beforehand, so that I can upload it into the software, plan your case, and then have a plan that's specific to your shoulder at the time of surgery. Now, the other thing we have you do a few days before surgery is we have you start wiping the area of the surgery with benzoyl peroxide wipes. There are some bacteria that live on the skin that can cause problems with shoulder replacement surgery. And so we want to try to decrease the amount of bacteria in the skin. So we have you buy some benzoyl peroxide wipes at your local drugstore, and you can start using those on the area to prep the skin for about 3 days before surgery. And that'll help decrease the amount of bacteria in the skin and lower your risk of infection. Now, myself and my physician's assistant are always available if you have any questions either before or after surgery. And hopefully this video helps answer some of the common questions that you might have. Have a great day.